For our visit with Dr. Kevin Kavanagh. He is a retired ENT from Somerset, Kentucky, also founder of Health Watch USA. And how are you this morning, Kevin?
Oh, I'm very good, Jack.
I just got a text, 10 seconds ago, and so I don't want to, you don't get thrown, but I was going to say I don't want to throw you here, but from a friend and listener, Bob, who says, headline from the BBC, flu virus with pandemic potential found in China. You know anything about that at all?
Yeah, I read about that last night. I actually texted that to you with a little trepidation. I thought, well, should we discuss this bad news or not? But in reality, it's not bad news because these viruses, they emerge out of China commonly. That's why I said this coronavirus probably isn't some Chinese bioweapon. The N1H1 virus that emerged has been around for some time. Hopefully they'll be able to contain it. They've been able to contain other viruses. And I think the experience that the Chinese has had with the coronavirus has them geared up to make sure that that virus doesn't spread. So at this point, although one should keep an eye on that, the two big learning things are, one, this happens commonly in China, so our current virus isn't a bioweapon. And two, even if we get through this pandemic, we are probably sometime in the future, near future, within the next couple of years, be faced with the emergence of another viral pathogen. But the chances of this one coming probably are not as great as what those headlines are saying. So it's been around for a while, from what I understand.
And now Republicans, with the exception of the president, are pushing mask wearing.
That's correct. About everybody is, except for the president, unfortunately. He says that they're voluntary. There was a Senate hearing yesterday, which I found to be a little bit depressing regarding how we were doing with the coronavirus. But the one big positive item was that Lamar Alexander, who's the Republican chairman, he's the senator from Tennessee, he said in his opening statement that the president should wear a mask. He actually called the president out. And to me, if we start to have a change in how we address this virus and a change in what the messaging is from our leadership, that we'll then be able to handle this virus. Remember, it's not like we don't know how to stop it. We do. It's simple. Wear masks, social distance, and wash your hands. If you do that, there are a number of modeling studies which show the epidemic will slowly burn out. Instead, we're hanging out in bars, we're partying, we are doing everything we should not be doing, and we see rates in our southern states just skyrocketing.
And Arizona has closed down bars and gyms and movie theaters and all that kind of stuff, as well as some other areas, right?
Yes, and they're going backwards. A number of states are. The one I found interesting is that New Jersey, which is the only state besides Rhode Island, which has falling rates, has also, from what I heard, canceled indoor dining. So what they're doing is they're starting to close down as these other states are doing so poorly, because what they're saying is, look, this virus doesn't respect geographical boundaries. We've seen that in Kentucky with Warren County and the surrounding rural counties that became hot spots. If other states are doing poorly, the virus is going to come into them. So that's why we need a national strategy. Now, you could take a look at Kentucky. We could be doing great, but we'll have someone from Michigan who is down hanging out on a beach in Florida, picked up the virus, drives up I-75, stops off at a restaurant in Hamburg and starts spreading the virus, or stops off at a bar in Hamburg. And so these activities we still need to look at kind of as being high risk. At least that's my opinion. And I think that when the rest of the nation's not doing well, I think we need to take note and do some defensive action so we keep our rates low here in Kentucky.
Ollie, you said something to me earlier this morning. You said, don't you feel like we're headed for another closure? Mm-hmm. And I do. I do think that's, if we don't start doing what you just said, wearing the mask, keeping our distance, washing our hands, and taking that seriously, I think we're going to have to close again.
Well, and that's what I'm scared of, because one of the depressing things from yesterday's hearing is that the rates are so great in many, many areas, they can't do contact tracing. There's just too many people. And the idea of let the states go their own way in federalism, that just doesn't work in preventing the spread of the virus. Now, it may work once you've got an outbreak and the forest fires are raging. Yes, put the governor in charge of clamping that down. But as far as spreading the virus knows no geographic boundaries. We need to have consistent messaging across the nation and consistent policies. And that's why I found the statements from Lamar Alexander so very beneficial and refreshing. And that to me was the sign of real hope that maybe as a nation we're going to join together and pull out of this.
Dr. Fauci yesterday said when he was appearing before the Senate Health Committee that we could see the coronavirus infections reach as high as 100,000 a day. We're at 40,000 plus now. And, man, if that doesn't get your attention, I don't think anything will.
Yes, you can tell he was upset about this. There's not much scientists can do. I know one Democratic senator came down on a director of the CDC, Robert Redfield, that we didn't implement Harvard's recommendations of contact tracing. And unfortunately, the answer was, which wasn't stated, but the real answer was, there were too many cases to do that. We really need to start to bring down these cases. All of the work that we did with the first closures has essentially been reversed. There are very few states that are doing well. They're mainly in the Northeast that went through a terrible ordeal. And unfortunately, it looks like much of the nation can't learn from others. They have to go through the ordeal themselves. And one of the most telling things is that UK and many of the European Union countries now have a travel ban on U.S. travel.
All right, that started yesterday. I was shocked. I was really shocked. They said they're going to review it again in a couple of weeks, but I don't blame them. Do you?
Well, no. And I mean, you can do all these political talking points and you can look at all these numbers and statistics and spin them every way you want. But the reality is things are not going well here as far as prevention of cases. Now, I should add that the deaths are still low, which is the one hopeful sign. But unfortunately, deaths are lagging indicators. And also, we're beginning to learn more about long-term sequelae of this disease, especially if you've been in the ICU. So this disease is still very serious, even in the young, and we need to do everything we can to avoid it and to keep this virus from spreading. So please, wear your masks and do social distancing.
Something we haven't heard about for a while, or I haven't anyway, is the multisystem inflammatory syndrome in children. What's up with that?
Well, it's still out there. They are doing studies. There's been a recent paper out which showed approximately 300 cases have come about in the United States. And so it is of concern. 300 cases is not many when you look at all of the children that have become infected. But you know, mothers, parents, and everybody are extremely protective of children. So if there is any risk at all to children, we need to make sure that they are protected. So this is something that we need to do, especially when we start opening schools, is make sure that we do this in a safe manner.
Dr. Kevin Kavanagh, thank you so much, and we will talk to you again on Friday.